Your heart is a muscular organ located slightly left on the center of your chest and is divided into 4 chambers, 2 on the right and 2 on the left. 4 valves link the chambers, which ensure blood is pumped in the right direction. The mitral valve is located between your heart's 2 left chambers. It consists of 2 flaps of tissue that open and close to make sure blood flows only one way. Mitral regurgitation, also known as MR, is a condition in which this valve fails to close completely and blood leaks backwards. MR makes your heart work harder to pump blood to the body, which leads to an enlarged heart and pressure on your lungs. If left untreated, it could lead to heart failure. MR is more common than you think. 1 in 10 people over 65 years old have moderate to severe disease. Of those with heart disease, MR affects 4 million people in the U.S. alone, and less than 2% are treated. Meet Kim. She's been feeling fatigued and short of breath. She visits her doctor, who listens to her heart. He hears an unusual sound and sends her to a cardiologist for an ultrasound. Kim's cardiologist reads the results and informs Kim that she has MR and explains her treatment options. Depending on the seriousness of MR, there are different treatment options: medication, surgery, or a minimally invasive repair or replacement device. With her cardiologist's advice, Kim is initially prescribed medications. However, for many patients, medications may not be enough to treat their disease. Kim was still having symptoms. Kim is then assessed for surgery, but her heart team recommends the minimally invasive repair device. This kind of repair is known as TEER, or transcatheter edge-to-edge repair. TEER is an established therapy with a short hospital stay. After her repair procedure, Kim feels ready to be more active. She's back to the gym and goes dancing with her friends. MR is a serious but treatable condition. If you or a loved one would like to know more about MR and all your treatment options, talk to your doctor today. Your doctor can describe the risks and benefits to help you decide which option is right for you.